Good afternoon. My name is Adrian Dix. I'm the BC Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for Tuesday, April 21st. I want to acknowledge that we're on the territories of the Lekwungen-speaking people, of the Sungis, and the Esquimalt First Nations. And with that, I wanted to introduce Dr. Bonnie Henry.
Thank you and good afternoon. For today's update, we have 25 new cases who have tested positive in our numbers today here in British Columbia, bringing our total of test positive cases to 1,724. That includes 707 people in the Vancouver Coastal Health Region, 715 in the Fraser Health Region, 109 people now on Vancouver Island Health, 153 in Interior Health Region, and 40 people in the Northern Health Region. We have no new long-term care facility outbreaks today. We're now up to 319 cases in long-term care or assisted living, with 20 outbreaks ongoing still in our long-term care and assisted living facilities, and one associated with a unit in acute care facility. We're up to 76 people who are associated with the Mission Federal Correctional Facility, including 65 inmates and 11 staff. In addition, I've talked about our concerns about workers who have returned from working in the Curl Lake project in northern Alberta. We have no new people to identify, but I just want to reiterate the importance of anybody who has worked at Curl Lake since the end of March, that we are asking you, requiring you to self-isolate for 14 days after your return, and recognizing that some people may have already been back for more than 14 days. If you do have symptoms, or some of your close contacts have symptoms that might be associated with COVID-19, to connect with 811 or to call your local public health or your primary care provider so we can have you assessed and tested if needed. In addition, we have now 109 people who are hospitalized with COVID-19 here in BC, including 51 people in critical care and ICU. We have one additional death to report since our last reporting period. Another one of our seniors, our elders, who has passed away from a long-term care facility outbreak in Vancouver Coastal Health. Our family, our thoughts go out to the family and to the caregivers of this person. There are 1,041 people who are considered fully recovered from COVID-19 in BC. In addition, today I want to let people know about an additional outbreak that has been identified in the Vancouver Coastal Health Region at the United Poultry Company in Vancouver. A number of employees have tested positive. This came to light over the weekend when Vancouver Coastal Health was investigating one of the community cases that had been identified, and it became apparent there were a number of other people in the workplace who were positive, and we now have up to 28 employees who have tested positive for this virus. Not all of those people are included in today's numbers, as some of the testing was done yesterday and will be reported over the coming days. However, we did get an updated outbreak report from Vancouver Coastal, so I'm giving you the numbers of people that we know about right now. The plant has been closed, and the close contacts have been notified of the people we know, and the investigation with Vancouver Coastal Health leading and working with the Canadian Food Inspection Agency, as this is a federally inspected plant. So the health teams are doing the contact tracing and investigation of this outbreak even as we speak. I do want to say that I know there will be concerns about the products that have come out of this. So this is a chicken processing plant. We don't have any evidence that COVID-19 can be spread from meat and from consuming of products like that, or from packaging on meat or chicken in this case. On the other hand, we do know that poultry, raw poultry, can have other bacteria on it, particularly Salmonella and Campylobacter, and it's very important that people maintain the important hygiene practices around handling of raw chicken, including cleaning your hands, being mindful of cross-contamination, making sure that poultry is cooked appropriately, and making sure that you clean surfaces after handling raw poultry. I want to talk a little bit about our goal in public health, in how we're moving forward in managing the pandemic here in British Columbia over the coming weeks and months. Our goal, of course, is to do all we can to limit the potential for transmission and also to minimize the impact of these necessary public health measures on our communities and our families across the province. So every decision that we take about what to do, about how to lessen some of the restrictions, what restrictions we put in, how to manage them, and how to allow people to continue with their lives while maintaining some of the important restrictions, are things that we have considered in great detail. We have stepped up in British Columbia, despite the hardships that many of these public health measures have entailed. And you have recognized the importance of maintaining things like our safe physical distance, being mindful of those around us, keeping our community strong, and showing that compassion and care that we can get through this together. We know that this has been hard on all of you, on all of us, both mentally, emotionally, financially, and in some cases physically as well. I understand that this is not easy, but we can look to the future knowing that we're getting through this together, that it is not forever, but we must continue to act today. We are at that important crossroads in these few weeks right now, and I know you've heard this before, but every day counts and every action counts, and we look at what's happened with the most recent outbreak. We need to find the cases in our community. We need to contain these outbreaks so that they don't spread. And when we are maintaining our distances, these unrecognized transmissions don't spread widely. We don't get those explosive outbreaks that we've seen in some other communities. But this remains incredibly important right now. This virus continues to circulate in our communities around the province, and sometimes it's unknown. It's unknown because we may not recognize that we're sick, or we may have that feeling that we need to go into work, that we need to be present to take care of the essential business that we're doing and overcome those symptoms that we have. Right now is so important for those of us, for all of us, to recognize in ourselves and in those we are working with. If you have a respiratory illness, stay home. If you have a cough, if you have the sniffles, if you're feeling unwell, stay home. That is the most important thing that we need to continue to do within our communities, our families, and our businesses right now. The other important things, of course, are maintaining that safe distance, cleaning our hands regularly, maintaining cleanliness in our environment, particularly those high-touch areas. Getting back to work is something that we are all looking forward to. We are looking ahead and thinking about getting back to school, getting back to seeing our family and our friends again. But now is the time to start thinking about how do we do this safely with our precautions in place, and making sure we have those in place to protect those who are most likely to have severe illness from this disease, particularly our elders and our seniors, our younger populations who have underlying health conditions like diabetes or immune suppression, who are going through cancer treatments, people with heart disease. We are all at risk if we start transmitting this virus in our community, and we know that if we become sick and we pass it on, the people that we are closest to are the ones that are more likely to be affected. So our focus needs to ensure that the storm has lessened and passed before we let up on our restrictions. But to our workers, our entrepreneurs, our business owners, they can join the essential workers who have done so much these past weeks to keep our economy going, to keep our essential services, the things we need in place as this wave has passed. Every time people step into our classroom, onto a construction site, or into a hospital and do it safely right now, know that we appreciate all that you are doing. We need to stay vigilant, we need to stay connected, and we need to stay committed to this. We will find our new normal in the coming weeks, but it is not yet the time to lessen our guard. We need to continue to get through this together by remaining kind to each other, remaining calm, and staying safe.
Thank you very much, Dr. Henry, and on behalf, I know, of everyone who's working on COVID-19 throughout the hospital system, I wanted to join Dr. Henry in passing on our condolences to the family of the person who died in the last 24 hours as a result of COVID-19. It is a very, very difficult thing in these times, and they and the other 86 families of people who have passed away are in our thoughts and in our hearts every day. Every person is important. Every case is important. And that's the way that we're trying to address this issue together in BC. I wanted to note we have, as Dr. Henry said, 109 people in acute care hospitals. That's 55 in Fraser Health and 35 in Vancouver Coastal Health, and then 11 in Interior Health, 5 on the island, 3 in Northern Health, for a total of 109. Just to put it in context, we have 4,268 available beds. Our occupancy rate is at about 61.7%, which is slightly higher than it was a week or so ago. The occupancy rate in critical care is 45.8%. Importantly, I wanted to talk briefly about emergency room visits. There were on March 9th, 6,559 emergency room visits in BC in that day, which was a typical day in that period. That number dropped to April 6th, when the number was under 3,000, 2,995. Yesterday, the number of emergency room visits was back up to 4,015. It's one of the reasons why Dr. Henry and I have been saying to people that the healthcare system is there for you, that there are many, many people struggling with non-COVID-19 related conditions right now, and that system is there for you. And I think people are listening. I see the return towards more normal levels, still well below what it was before, but more normal levels, as a sign that, as a good sign in the sense that people are seeking out care when they need it. And I want to encourage people to always, always, always do that. I want to bring further updates on issues around personal protective equipment, and in particular with respect to respirators. There's always questions about these issues, and there's some discussion, and there has been some discussion in other provinces. This is why yesterday I talked about the importance of the testing that we're doing of all new personal protective equipment in BC before it's put into service, before it's used by healthcare workers in BC. And just to say that we have, because there's a lot of talk of different equipment, that N95 respirators are particular disposable particulate mask that's worn on the face and covers the nose and mouth. It's used to reduce the wearer's risk of inhaling hazardous airborne particles, including biological agents such as bacteria and viruses. And the 95 in N95 means the respirator filters out at least 95% of airborne particles. A respirator will only work if used correctly. Thus, the key elements for respiratory protection are fit testing and training of each worker in the use, maintenance, and care of the respirator. Occupational health and safety teams undertake fit testing and education with healthcare workers prior to them donning respirators to ensure their safety. N95 is the certified standard code used in the United States and Canada under the National Institute of Occupational Safety and Health, or NIOSH. And while 3M is our traditional supplier, other manufacturers can and do produce N95 respirators. It's about the standard, not the brand. There is something called a KN95 respirator, which you'll have heard about. It has equally effective properties as the N95 respirator. The difference in name is reflective of the different certification systems used in China, where the KN95 is standard code, or other countries such as Australia, New Zealand, Korea, or Japan. To expand the availability of N95 respirators during the pandemic, equivalent alternate standards have been deemed acceptable by Health Canada. This includes respirators that are approved or certified under standards used in other countries that are similar to NIOSH-approved N95 respirators. For example, this includes KN95 respirators. So I want to say in that context, give a summary of the PPE we've received through our own efforts as well as from the federal government. With respect to N95 or KN95 respirators, we have, and all of these require testing and are being tested before being put into service. We received 3,700,000 N95s and KN95s. Approximately 3 million of those are N95s. This is principally from China. Surgical masks, 1 million. Face shields, 300,000. Gloves, 1 million sets. From the federal government, and these are tested and in the system, N95s, 98,700. Surgical masks, 918,000. Gloves, 224,400. And as you'll know, Alberta is sending us 250,000 N95s, which are a 3M product, and therefore will not require testing. As well, we're receiving many donations, and we're very appreciative of that. So I wanted to bring people up to date as to where we are and the extraordinary efforts being led by both the health authorities and the Ministry of Health to ensure that people have adequate protection in our healthcare system. I also wanted to do a brief update on some of the improvements to primary care that have taken place in the province. In the last month, well, we've obviously been focused on other things. 3 new urgent and primary care centers have opened in permanent locations. In Vernon, the UPCC is now operational. Its permanent location. It had opened last December at a temporary location at 3306A 32nd Avenue in Vernon. In Abbotsford, as of April 17th, a new UPCC is now open at Unit 100-2692 Clearvic Road, and it's currently functioning as a COVID-19 assessment site and will transition to a UPCC at the appropriate time. And in Castlegar, as was announced last month, a new UPCC opened April 6th at the Castlegar and District Community Health Center. And it's just to say that we're continuing to work hard to ensure that that primary care, in particular, in a time when primary care and UPCCs have, I think, shown their worth, is continuing to develop and expand even within the challenges of COVID-19. And finally, I want to just highlight the town halls that are taking place in all of the health authorities. I want to thank all of the MLAs involved, all of the CEOs and medical health officers involved. Last Friday, Bowen Ma and John Yap hosted a town hall with Vancouver Coastal Health that had more than 17,000 people tuned in. Yesterday, Rachna Singh and John Martin, 2 of my colleagues in the legislature, along with CEO Victoria Lee and Medical Officer of Health, Dr. Martin Lavoie, hosted about 8,000 people at the town hall. Tonight on Vancouver Island, Mitzi Dean, Sonia Firstino, with CEO Kathy McNeil, and Medical Officer Health Officer Dr. Richard Stanwyck will be hosting at 7:15 a virtual town hall. On the 22nd, tomorrow, Northern Health will be hosted by MLAs Mike Bernier and Doug Donaldson, with CEO Kathy Ulrich and Raina Fumerton, who's the medical health officer there. And on Thursday, April 23rd, in Interior Health, colleagues Norm Letnick, Katrina Conroy, and Dr. Sue Pollack and Susan Brown, the CEO of Interior Health, will be hosting a town hall. I again want to express my appreciation to all of those involved and the thousands of British Columbians who are asking questions. Finally, I want to say that the Premier has said that he's leading an all BC government approach on how to best move BC forward. This involves all ministries and all agencies, and as he said, we need to be, in every case, directed by the science. He'll, of course, be saying more in the coming weeks about BC's ways forward, updating everyone regularly, as he's doing and he will do tomorrow. For my part, I'm focused obviously on the healthcare system and restoring scheduled surgeries. That's a huge effort that involves Deputy Minister Stephen Brown, Michael Marchbank, who has been appointed to lead this task, and many more. And we're looking at all of these questions, understanding the impact that the cancellation of surgeries has had on people and the need for people of those surgeries. Everybody involved, from Dr. Henry to Stephen Brown to Mr. Marchbank to all of the people involved, are all in that work and preparing that work. And I guess I want to say this, though. It's still dependent on all of us being all in on flattening the curve, all of us driving the number of new transmissions of COVID-19 down, all of us doing what we can do, from washing our hands to staying home when we're sick, to make sure that we can do everything we can to flatten the curve so that we can return not to the old normal, but to a new normal that allows us to function more and more openly as a society, as a group in BC. So I want to thank everybody for all they're doing, and say just a few words in French, and then we'll be happy to take your questions. Aujourd'hui, nous annonçons 25 nouveaux cas pour un total de 1724 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 dans la région de santé de Vancouver Coastal, pour un total de 87 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Chaque région de santé compte des patients atteints de COVID-19, bien entendu. 707 se trouvent à Vancouver Coastal, 715 à Fraser, 109 sur l'île de Vancouver, 153 dans l'intérieur et 40 au nord. Parmi l'ensemble des cas confirmés de COVID-19, 109 personnes sont actuellement hospitalisées, dont 51 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. And with that, we're happy to take your questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question. Please unmute your phones. You will not be audible until we call your name. First question today is from Ian Bailey, Globe and Mail. Go ahead, please.
Wearing of non-medical masks for certain situations may be helpful. So within those parameters of how we make sure that we're not setting up a situation where we're going to have lots of contact between people that will then allow for spread in our community. Those are the things that are most important. And you know, I talked about this yesterday with the restaurant industry. I'm looking to industry to say, how can we do that within those parameters for the coming months? Recognizing that this is not forever. This is until we reach a point where we can get back to a much more normal, and that has to do with the amount of immunity in our population and the behavior of the virus over time. So we've said it before, a lot of it depends on having a vaccine, and that's what's going to protect us the most. But between now and then, there's ways that we can open up our communities, open up our businesses, and still maintain that important safety factor that protects us all.
Next question is from Binder Sujin, CTV. Go ahead.
Hi, Dr. Henry. Just following up on what Ian asked there. There are some businesses where I imagine you can't get rid of the close contact if you're not thinking about like massage therapists, physiotherapists, dentists, if you're getting your eyes checked. And I know there are a number of people who are looking forward to getting back to being able to access some of those health services. But I'm wondering, how does that look in the new normal? I mean, businesses, I guess, would have to be able to deal with a level of risk in case any one of their employees came down with it and what that would mean in the community. But also a lot of these appointments are usually scheduled back to back. So I'm just wondering sort of what you envision that back to normal in the next, or new normal in the next year and a half might look like.
Exactly, and you've touched on some of those important points. So yes, I do think it's important for us to get back to physiotherapy. You know, we know it's really important for people who are recovering from those surgeries that are going to start again, for example. So yes, we know that there's dental procedures that need to happen, but we need to do it in the context that recognizes that we are at risk as a community and we are at risk individually in our practice. So yes, we need to look at not having everybody sitting in the waiting room at the same time. So it may mean that we have people coming in at set appointments. We may not be able to see as many people in a day, but we have to do it in a way that we have the appropriate protection regulations in place. We have hand hygiene available. We have separation for the reception staff, for example, for people sitting in a waiting area, making sure that we can have this, minimize the number of people. So it's going to take differences in our flow through and how we do that. And we were looking at, and it's going to take us to be very vigilant about our staff and about us if we're feeling unwell at all to stay home. And also we need to understand the impacts in the community if we start to allow other things to happen as well. So if I'm working in a higher risk environment, like in a dental office or a physiotherapist, then I need to still be vigilant at home that I'm not having lots of other connections, because I'm more likely to get sick and more likely to bring it into my practice or bring it back into my family life. So those are all the things that we need to start thinking about, where we can find that balance where we increase what we're doing, but it's not going to be right away back to what it was before, when we have lots of people sitting together for periods of time and then we have close contact with them. So I think those are some really good things to think about. How do I make sure that we don't have all the workers coming in sick and not recognizing it, and a couple of outbreaks that we've had recently have expanded because people have not paid attention to even having mild illness, and that presenteeism that we have. And I know it's very strong in healthcare that we feel like we need to be there because people are depending on us. We need to be really careful about that for the next year, and that cannot change. We need to have that being able to stay away from others if we're sick, being able to clean our hands regularly, being able to maintain safe distances, putting in barriers that protect us from spreading our droplets to others. And that may be a mask, that may be physical barriers like a plexiglass.
Next question is from Shannon Waters, BC Today.
Hi, Dr. Henry. We seem to be looking to the future more and more these days, and when we talk about a vaccine being developed, the timeline is often a year, but once it's proven to be effective, to whatever degree that might be, it's then going to have to be deployed. Saw some polling today that suggested that about 73% of people, Canadians polled right now, say that they would be willing to get vaccinated were one developed. So I'm wondering your thoughts on that issue. Do we know what kind of compliance with a vaccine program is going to be necessary in order to provide adequate herd immunity once we get to the point where we have a vaccine? And do we have any idea how long it might take to deploy a vaccine once one is developed?
Yeah, so really good questions. And we have a little bit of an idea, and part of it comes from the planning, and we go back to our pandemic influenza plans, where vaccine is very much a part of that planning process. So we do have plans across the province and in Canada for mass vaccination clinics, and for also how do we determine the sequencing of immunization. So it doesn't mean that everybody has to have this, and certainly we do not have any mandatory immunizations in this country, and I would not see us as having mandatory immunization for this either. But it is incredibly important that we do what we can to protect those who are most vulnerable to disease. So I would see things like people like healthcare workers being first in line for the vaccine, as well as our seniors and elders, as well as people who have immune compromise or underlying conditions that make them more at risk. So we've been thinking about that quite a bit, and we do have a framework for how we'll roll that out, and it can happen quite quickly. We have seen that in 2009 with the pandemic influenza vaccine when it was available. It was done more or less well in different places, and I think we have learned quite a lot from that. So it could be in a matter of months that we would have it available and rolled out to people across the province, and we would be looking at targeting people most at risk to start with.
Keith Baldry, Global News.
Hi, hi, Dr. Henry and Minister Dix. Thanks for this. Just regarding that outbreak at the chicken processing plant, we've got, of course, that massive outbreak at the meat packing plant in South Alberta, and now this one. I just received an email from someone anonymously who says his wife works in a chicken processing plant in the Tri-Cities, and at least one employee there is tested positive. Is there any consideration, or are you considering having more inspections of these places where people work in close quarters and perhaps social distancing is not being observed on the at the work site?
Yeah, absolutely. And Vancouver Coastal, there are several plants that are owned, as I understand, at least one other that's owned by the same company, and it will be inspected. I'm not aware of any others having confirmed cases at this point. But yes, we are very concerned, and of course we were watching what was happening in High River. One of the differences, of course, is we don't have the same communal living concept here with these plants as the one in High River, but it doesn't mean that, we need to make sure that things are being done appropriately. And, this goes back to this is a federally run plant, so the Canadian Food Inspection Agency is responsible for ensuring under the Safe Food Act for Canadians, or the Safe Food for Canadians Act, and part of the requirements are that they do have a plan for managing in the conditions of COVID-19. So yes, I know Vancouver Coastal, and we've been talking around the province, not only for federally inspected plants, but the provincially inspected plants, to make sure that people are following the guidance. And again, I've talked already about the importance of recognizing if you're not feeling well, if there is illness in the environment, that people need to be staying home, and we need to hear about it. In public health, testing is available for anybody with symptoms of COVID-19, and we will follow up and do the investigation, and that's how this was uncovered. And it also speaks to recognizing that even essential workplaces have to have precautions in place and have to have awareness and monitor staff for illness and ensure that they are taking those appropriate steps to protect people who are working in those environments. And we will be stepping up for sure.
Next question is from Cheryl Jean, CKPG.
Yeah, this is a question for Minister Dix. You had alluded to the resumption of non-urgent surgeries. Can you expand on that a little bit with a timeline, if possible?
The timeline. The timeline is that we started working on this before the decision was taken to cancel what are defined as non-urgent elective surgeries, but which are really surgical, scheduled surgeries, and they're all important and they're all significant, and people require them in the healthcare system. So that work has been continuing since that point. It'll require a very significant effort that will involve everyone involved in medicine and hospital acute care across the province, and obviously we have to be prepared and make all the considerations to ensure that it's safe at this time, which means adequate PPE. That's why I was emphasizing that question earlier, and it requires an assessment now of wait lists now that we've canceled a very significant number of surgeries. So that work is happening now, and it requires a few things to happen. It requires us in these weeks to continue flattening the curve. That's important. It requires enormous and significant planning to start again and to decide what priorities are and what surgeries can be done most safely at this time. And it requires us being certain that our acute care facilities are able to deal with this in individual cases and across the system properly. But look, this is important, and we're all into it. And I think once we get going, we have to, in the safest possible way, give the same kind of effort we've made in the last weeks and months since January in addressing COVID-19 in British Columbia, because we have now a significant challenge, and people, all of them, need that surgery, and so we have a lot of work to be done. But we're starting that work now. We're starting the planning now. It involves a lot of healthcare professionals, but it also involves patients and talking to those patients about their circumstances, and that will be a requirement in advance of beginning as well, because what we talked about earlier, what Dr. Henry has talked about for the last week or so, is ensuring that people are confident in returning to healthcare settings. And we're seeing that happen in the emergency room over the last week and really since April 6th, and that's a good thing in a general sense, but we have to talk to patients, those waiting to have their surgeries, about their level of preparation as well. So a lot of work will go into it, but it is all dependent on us continuing to be 100% all in and flattening this curve, doing all the things we need to do. And the most important of those things is that if we're sick, stay home. And we need to continue to do that and all of the other things that both Dr. Henry advises and, of course, are part of Dr. Henry's provincial health orders.
Next question is from Patrick Johnston, Post Media.
Yeah, hi. I'm looking at this new normal, and I'm wondering what advice you have for team sports organizations like hockey and soccer in terms of both whether they have a season starting or whether they're planning their registrations and schedules for the fall.
Yeah, really good question as well. And I don't have the perfect answer for that yet. I do think, and it's one of the things we're looking at, I think it's really important. We know that it's less risky outside than inside, and we know how important it is to have physical exercise, and particularly for young people over the summer months and into the fall. So I think there are ways it can be done, but we need to look at how do we do it safely so that we're not sharing water bottles, sharing food, we're not coming together and in ways we're respecting those distances, those safe distances, but still being able to carry on. We are also thinking about, the numbers of people that are involved, and we may have to limit that for a period of, for this summer, for the coming year, so that we don't have large crowds watching games, for example. So I think all of those things are things that I can give some parameters around, but I need the people who are involved in those setting up those types of team sports to think about how we can do it in this new normal for now, recognizing that it's not going to be forever, but it is going to be for this next season, and we need to find ways to do it that allows especially young people to get out there and to be physically active and be together.
Next question is from Rob Shaw, Vancouver Sun.
Oh, hi, Dr. Henry. Yesterday you spoke about opening up the COVID-19 testing to anyone with symptoms and then using contact tracing to go back. It's sort of like what we did at the beginning of the outbreak, but this time we're going back and contact tracing 48 hours before a person was symptomatic. And it seems like that's going to be an enormous undertaking in terms of labor and people, tracking down all these cases, isolating them, figuring out what buses they were on, what stores they went into, who they came into contact with. So I was wondering if you could just kind of describe the sheer logistics of what this entails compared to anything we've done before in the province. Do we need more staff to do this? And then what happens if we get to the point where we discover people might not have any symptoms at all and still be spreading that? How do we contact trace that? And then I guess just finally, can you update us on whether we're thinking of using mobile phone contact tracing apps in the weeks ahead as we deal with this?
Yeah, so I'll start by saying this is what we do. This is what we have been doing from the very beginning, and that's the work of public health. We do this for all of our reportable communicable diseases, and from the very beginning we have been taking histories from cases for that 48 hours or longer before their symptoms started. And it's to find out where they've been, what they've been doing, but also people that may have been in close contact. So it speaks to the asymptomatic spread as well. What we do know is that most of this is spread between people who spend time together, so indoors. So having a meal with somebody, being in a meeting room with people for longer periods of time, when we have even mild symptoms, and sometimes, the jury's out about how much asymptomatic spread there is, but we do know that when you have those close contacts, when somebody is talking, when you're in a close environment together within a meter, those are the situations that we know this is transmitted. So we know it's transmitted mostly to the people that we are closest with, and that we bring it home to our families, and particularly our elders and others in our families. We bring it into our workplace, and we sit and have lunch with people, and that's where we spread it to each other. Or we're in the break room together, or we, those are the types of settings where mostly it is spread. So those are the things that we try and find in public health, and that's the work that we do and have been doing. And yes, we've ramped up the people who are able to do that, and also who support us in monitoring cases, people who are infected, who are being isolated at home, as well as the close contacts, because we want them to stay away from others. If we know you've been in contact with somebody who's a case, we want you to stay away from others for the period of the incubation period, so that if you get sick, you're not passing it on to anybody else. So yes, that is the work that we've been doing. Yes, we've been ramping it up, and we expect to do it more coming into this new phase where we are much more focusing on everybody in the community now and detecting those people. In terms of an app, we have been using some apps voluntarily in some parts of the province already to help facilitate that ongoing connection with people after they've been identified. There is an initiative nationally to look at an app that people would voluntarily put on their phone. Of course, we're very sensitive to the privacy issues around that, and I'm not entirely sure yet whether we're going to be part of that here in BC. There's lots of different apps around the world. There's the one from Singapore as well. It's called Trace Together, that I know Alberta is looking at in some detail, and we are also in BC. So one of the things that I found is that there's a whole lot of people that have apps that we need to sort of sort through, and the federal government, the Public Health Agency of Canada, has done quite a bit of that work. So we are looking at what could be helpful for us, mindful of the privacy aspects that we're all concerned about.
Next question is from Marcella Bernardo, News 1130.
Hi again. Sorry to sound a bit like a broken record, but with the weather getting better and physical distancing still a major issue in the Metro Vancouver area, Dr. Henry, how close are you to expanding public safety orders so that they include high-traffic parks and beaches?
I'm not sure entirely what you mean. Do you mean forbidding people from going there, if that's what you're...
Well, restricting access if you could, because it seems like people aren't listening and we're seeing lots of crowds in high-traffic areas.
So I do believe, and I've said this repeatedly, how important it is for us to have access to outdoor areas, particularly in urban areas where people being cooped up inside can lead to a lot of other anxieties and challenges and problems, including mental health problems. What we need to do is if we're having challenges in certain parks in certain areas, we need to look at, with our municipal planners, with the bylaw officers, look at how we make it so it is easier to maintain those physical distance. And there's some things that we know are really helpful, like having one-way routes around parks or around parks and beaches and other places. Also closing roads so that we have more space for people, less for when we don't need cars, and that is certainly something that's happening in Vancouver and some of the other municipalities. Those are the things that I think are more important. It is also, we need to look at how do we increase our ability to be outside in a safe way over the coming months.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon with all the information covered off. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Georgie Smith, CBC.
Good afternoon, Dr. Henry. Can you confirm when the first case was confirmed at United Poultry? Did the outbreak protocol start immediately at the plant, or were all the cases detected at the same time?
Yeah, so Vancouver Coastal was notified on Sunday of a positive case, and as part of the case investigation, we always ask where somebody works, and it became apparent that that the person who was identified felt there were others at the workplace who were ill as well. So on Monday, Vancouver Coastal went into the plant to do an inspection, and the people who were at the plant on that day, anybody with symptoms was tested, and so those results have come in the last 24 hours. So they are working with CFIA. The plant was closed down, and an outbreak investigation is ongoing.
That's all the time we have today. Thank you.
Thank you.